Let's go on now to Chapter 2, Cell Injury and Adaptation. This may not look sexy, but on an exam it will be. Trust me. So when we talk about causes of cell injury, this is the fundamental thing you always have to think about. On these exams, they'll make you feel like you've never gone to medical school, but you have. And so the underlying principle is there. You just have to be able to recognize it. So what's the most common cause of cell injury in any eukaryotic cell is simply the lack of oxygen. What do we call that? Hypoxia. And it is the most common cause. And you can think of all these different organ systems, whether it's the CNS, the neuron, it's severely dependent upon the ability to have oxygen to carry out aerobic metabolism. You think of ways of not delivering oxygen to tissue, like anemias. The biggest problem with any anemia is what? Not be able to deliver oxygen, no matter what you call the anemia. Any vasculitis or vasculitides, all those diseases we talk about later on, what's the biggest problem? The underlying problem is hypoxic damage. If the heart is damaged in any disease process, whether it's ischemic, rheumatic, valvular, conduction, can't pump out the blood, what's going to lead to? Hypoxic damage. Carbon monoxide, what does it bind to? The same place that oxygen binds to in hemoglobin, therefore you can't deliver it, you die. If you destroy the medulla oblongata, where you have a respiratory centers, cardiac, can't deliver blood, hypoxic damage. All these different things that you've learned about really comes down to hypoxia. So is hypoxia all over USMLE? Yes. It'll be looking for you. So when we talk about the inability to provide ATP, the energy currency that's critical to any eukaryotic cell, we're affecting aerobic metabolism. And this becomes important when we talk about cell injury and think of each cell as you go through each organ system and studying it. What is its dependency on oxygen? If you understand that concept, then you can understand what's going to happen to it when there is the inability to deliver oxygen to that tissue. And what are some of the leading mechanisms that lead to hypoxia? I illustrated verbally, but you can see here that ischemia is another important term that occurs in any organ system that's dependent upon oxygen, is the inability to provide a blood flow to it. Any reduction in blood flow or perfusion, we have a problem. We're going to get hypoxic damage, and is the most common cause of hypoxia. Decreased arterial blood flow, that's obvious, but also you have to remember that if blood backs up into the organ, like congestive heart failure backing up the blood into the liver, you're going to get hypoxic damage to the zone 3 of the liver lobule, and eventually you'll get this chronic hypoxic state, and eventually the liver can go on to become sclerotic, what we call cardiac sclerosis or cardiac cirrhosis, and that just means scarring of the liver in response to the chronic hypoxic state. So obviously having a patient in congestive heart failure is not good because you have this passive congestion. We talked about decreased venous outflow. What are some examples? You think of atherosclerosis affecting the elastic and muscular arteries, and therefore leading to narrowing and inability to provide perfusion to the tissue that's supplied by that vessel affected by atherosclerotic plaque, which is a disease of the intima. A thrombus, we have intravascular coagulation occurring, leading to occlusion, obviously in somebody who is alive. We'll talk that a difference between a thrombus versus a blood clot, which is going to be extravascular. And when we do have an extravascular clotting of blood, we call that what is a generic term? Hematoma. Or if a thrombus breaks off and travels, what do we call a traveling thrombus? An embolus. And that's the definition. So what's the one book you want to use to study for the USMLE? Is a medical dictionary. And they're very reasonable. Or use the internet. Cardiopulmonary failure. This is a non-specific term in that it means that you have a problem with the ability of the heart or lungs to provide either perfusion because the pump is down, or the inability for gas exchange, leading to hypoxic damage. And there are many causes for this. Another important thing is, we mentioned a little earlier, is that anemia. No matter whether it's sickle cell, whether you talk about thalassemias, iron deficiency anemia, what are you not able to deliver to the tissue is oxygen. And that's the critical common denominator. So they're going to give you an anemia on the exam, but It's the underlying essence of its result to tissues, the inability to provide oxygen to the tissue, leading to going from an aerobic to an anaerobic state and leading to organ as well as tissue dysfunction. Another important cause of cell injury that you learned about, which is microbiology. Remember, when you talk about infections due to viruses, bacteria, parasites, fungi, and then a new entity that's recently been described in the last several decades are prion diseases, which is basically proteins that are able to change the conformation of normal ones and then altering the state. Like in neurons, we think of things like Creutzfeldt-Jakob disease or CJD as an example, and a variant of the CJD is what we call mad cow disease. So the essence is, when you talk about microbiology, and this will help you when you're going through microbiology, is that what causes a disease process due to an infectious agent, no matter what this category. And we'll go and review as we go through various organ systems, as well as an immunopath, as well as inflammation. And that is, there are two mechanisms that basically leads to tissue damage in infectious disease. One is there something unique about that organism that it contains a virulent factor that's going to cause damage directly. It could be an enzyme, it could be a protein. You think of exotoxins and endotoxins, or it's the body's response to it. And the one cell that you always have to think about, we're going to come back and always talk about that as a clinician, as well as being seen on the USMLE, is that of the macrophage and its role in releasing over 150 different cytokines in response to infectious disease, and organs like the liver or hepatocytes within the liver responding with reactive proteins. And this becomes very important when we talk about Chapter 3 and how we relate about inflammation, acute inflammation, and then we'll talk about chronic. So the mechanism of injury that we think of is, again, I just want to review this again, direct infection of the cells itself, and there's various mechanisms like causing apoptosis, programmed cell death without an inflammatory response, being cytopathic to the cells, just kills the cells, like virus is a classic example. We just talked about toxins that are made, exotoxins, endotoxins, and then we're going to talk about what is the body's response. Like we talk about the swine flu virus. Basically, what kills people with a swine flu virus is they're usually immunocompromised or have some other issues going on clinically, that the immune system is weaker, and now you have a virus that comes in and causes damage because of the macrophage and the hepatocytes response to the infection. And see, once you know one disease, you can figure out how it relates to other diseases. Another important category of mechanism of disease they love to ask about are immunologic reactions. One they'll always ask on no matter what step you're taking for the USMLE, and that is hypersensitivity reactions. You have to know the difference between 1, 2, 3, and 4. The one that gives students the hardest time is recognizing is the difference between hypersensitivity reaction 2 and 3. And 2 is a prelude to the immunopath section we'll get to later on, and that is hypersensitivity reaction type 2 is antibodies directed to a target cell or tissue, versus hypersensitivity reaction type 3 is going to be an antibody bound to a soluble molecule. And it can either form in tissue or it could form and circulate and be deposited in tissue. Another important category we're going to talk about is autoimmune diseases. And when we think of autoimmune disease, they tend to occur in females. Why females rather than males? There's a lot of speculation, but the easy way to remember it is that when you think of what sex has to have a very sensitive immune system, is the female, because she can get pregnant. And because during pregnancy it's an immunosuppressive state. Because otherwise the paternal antigens would cause an immunologic response, we'd never be here. We wouldn't be able to be born. So that immunosuppression has to be finely and delicately controlled so that the pregnancy can go through completion. And so that's why the most common sex to have autoimmune disease tend to be females. And what age, where there's a lot of stress in a woman's life, is reproductive age. And because of that, when you talk about SLE, Sjogren's, or other autoimmune diseases like scleroderma, you tend to see it in reproductive age. You're not going to see it typically in a 5-year-old female or a 92-year-old female, but there's always exceptions to the rule. Remember, diseases don't read textbooks, they create them, and they don't take exams either. Another important thing is congenital disorders. And when we talk about congenital disorders, you think of biochemistry again. We think of inborn errors of metabolism, where you have point mutations or some type of disruption to a particular gene that has alleles that are affected that lead to consequences of various organs that are dependent upon that biochemical pathway. And we have a section on genetic disorders. We'll go into more depth. You think of autosomal recessive disorders that primarily affect enzymes, and that's what you think of. Chemical injury, what do we think of? You think of pharmacology. A lot of the USMLE is going to be toxicology or toxicities associated with drugs and its uniqueness. So you think of poisons. We'll talk about environmental path. We'll think of cyanide, the likes of bind to cytochrome C oxidase, leading to a asphyxiant that now shuts down aerobic metabolism and basically leading to a hypoxic state. As you remember from biochemistry, that glycolysis is an inefficient way to produce ATP. Therefore, cells like neurons, hepatocytes, the tubular cells of the kidney are going to be vulnerable to cyanide poisoning. Arsenic is another poison that injures cells by binding to sulfhydryl groups, and then mercury causing toxicity, especially to neurons, leading to mad as a hatter. And we'll talk about how you became mad as a hatter when we get to the environmental lifestyle pathology. Pollution, obviously, is a critical exposure to the environment, to pollutants in the air, and that's why you think in legislation where people can't smoke in public areas or in hospitals. Otherwise, we can get diseases, and we'll talk about this later. Occupational exposure, like dry cleaners, you think of carbon tetrachloride. Asbestosis, we think of exposure to a natural material in the earth that's mined, as you recall, for insulation. Used to be in brake pads and other products. And if you aerosolize it and now inhale it into the lungs, what are you going to produce? A scarring process. We call that asbestosis, condition of fibrosing lung disease due to asbestos fibers. And then carbon monoxide poisoning, we talked about binding to the hemoglobin and not being able to deliver oxygen. Obviously, there are preventable diseases, and we're talking now as social or lifestyle choices. Too much alcohol can lead to damage to various organ systems, either acutely or chronically. Cigarette smoking, which is definitely going to be on the USMLE, it becomes critical in understanding the consequences. And then IV drug abuse or use will also have consequences from infections as well as degeneration as well as damage to the various organs that are susceptible to the drugs that people are taking. Physical forms of injury, you think of trauma, crushing injuries, blunt trauma, penetrating, gunshot wounds, knife wounds. There's not a lot of questions, but it's fairly obvious. Another important thing that can cause physical form of injury are burns, cutaneous burns, and the consequences that the largest organ in the body, the skin, can be altered and lead to changes in permeability of blood vessels in the first 24 hours. We'll talk about more of that when we get to the environmental pathology section. Obviously, you go from a thermal injury to a hypothermic injury. We think of frostbite, where tissues can't live in cold temperature because of metabolic processes are dependent upon a temperature of 37 degrees Celsius or 98.6 degrees Fahrenheit as a consequence of ice crystal formation and leading to damage to the cells. Ionizing radiation versus UV radiation, we'll talk about more about that in terms of various organs that are susceptible to this. And then obviously pressure as another form of injury to tissues. Nutritional or vitamin imbalance, the biggest problem in this country is having too much versus not enough. And because what's the second leading cause of premature preventable death in the United States today, both in children and in adults, is obesity, which is defined as a BMI or body mean index of greater than 30. So when you're studying for the USMLE, exercise. You don't want to become part of the pathology. So when we talk about protein, inadequate protein intake, there are various terms that are used that. We don't see that as an issue in this country. Marasmus, remember, is decreased caloric intake. That means all sources of material or dietary constituents that you take in from lipids, carbohydrate, and protein. Then you had kwashiorkor, decrease in total protein intake, Remember, the consequence of not having enough protein means the building blocks of all proteins are amino acids. So an important protein we'll come back to and we talk about pathology is albumin. And since if you can't have albumin, your oncotic pressures decrease, you can lead to edema, and that's why you can look at these programs on TV that showing children in other countries where they have protein deficiency, they have these large bellies, and that's a consequence of ascites as a decreased oncotic pressure. And we'll talk about edema when we get to the circulatory path, which is chapter 5. Anorexia nervosa, obviously, eating disorders, where you have an element of basically how one's self-perception becomes critical, and what is fat, what is skinny, and the sociologic and psychologic factors that determine how we body imaging, and this can lead to diseases like anorexia nervosa. Too much caloric intake is the biggest problem in the United States. It's estimated that the percentage of children over 4 years of age in the United States that are obese is 1 out of every 5. And now we're seeing type 2 diabetes, not in adults anymore, but in the pediatric population as young as 4 and 5 now. So eat enough while you're studying, but don't eat too much. Atherosclerosis, again, is a consequence of taking in too much lipid in the diet, causing damage. What you eat is what you are. If you eat meat at every meal for the 30 years or eat at McDonald's for 30 years, you will get atherosclerosis. Or because you're medical students or have gone through medical school, pizza is a big issue. If you had pizza 3 times a day for 30 years, you will get atherosclerosis. When we talk about nutritional and vitamin imbalances, we also have to talk about things that can occur are vitamin deficiencies. Remember, vitamins from biochemistry is essentially going to be cofactors in biochemical pathways. So you only need a small amount. So getting these mega pills is not going to be the thing that's going to help you take care of disease, because there's diseases that are called hypervitaminosis that can lead to tissue damage. If you have a balanced diet, it'll work out well. So what are some examples you've learned about? And those will be reviewed again in biochemistry later on when you listen to those tapes. Is vitamin A. You think of it's affecting retinoic acid, so it has importance in vision, so night blindness. It also is important in cells that are dividing, like squamous cells. You can get squamous metaplasia, where you change, remember metaplasia, growth of changing one adult cell type, whether it's epithelial or mesenchymal, to another type. Or if you immune deficiency, because it becomes important in the immunologic cells. Another thing that's very important, the most common structural protein in the body, as you recall, is collagen. So therefore, if you can't make collagen strong enough, like cross-linking it, that's what the vitamin C is important as a cofactor. Then you have problems, what we call scurvy, where your bone can't develop properly. You can have problems with wound healing, dehiscence of the wound, where it rips open. That's why I remember the sailors and the ancient mariners, they had to have lime on board to prevent the wounds from opening up, or if they're in battle. So that's a big problem. We can't see it today. When do we see it today in the United States? Scurvy is either child abuse or elder abuse, where people are locked in a closet and not given the nutritional support or given sunlight. Because the next one is vitamin D. So when we talk about vitamin D, it becomes important in the absorption of calcium in the diet. And if you don't get enough, you have to now break down your bone, or the bone becomes, we think of a disease like rickets, only occurs in children. But when you're an adult and your bones become soft, we call it osteomalacia. That's what malacia means. Another important vitamin, obviously, in the synthesis of your clotting factors is vitamin K. It's fat soluble, like A, D, and the other vitamin is E, that's fat soluble. And then another important vitamin is vitamin B12. If there's one thing they love to ask on the USMLE when it comes to 2 vitamins, it's vitamin D, calcium metabolism, and vitamin B12. Because it has multiple steps, and there are many things that can lead to it. Because of this multiple steps, the disease can now induce the likelihood of getting these type of deficiencies. So vitamin B12, remember, is a cofactor in the synthesis of nucleic acids. And so you're going to affect dividing cells. So you think of, remember, megaloblastic anemia, we have an asynchronous maturation where the cells get bigger because the delay in the maturation because of nucleic acid metabolism is altered. Obviously, it can affect, especially vitamin B12, over many years. It can lead to neuropathy. We'll talk more about vitamin B12 when we get to anemias. And it can also affect the posterior columns. For example, you get spinal cord degeneration as a consequence of this. Another important vitamin is folate. And remember, vitamin B12 is stored in two organ systems, hepatocytes and skeletal muscle. So it takes a long time for you to get vitamin B12 deficiency, but folate is another important vitamin that's important for nucleic acid synthesis, and therefore we don't store it in the body and we can use it up very quickly. And so what are some examples when you think of that? Neural tube defects can result from it, as well as megaloblastic anemia. Then niacin, pellagra or pellagra, depending on how you want to enunciate it, can lead to issues of diarrhea, affect the skin because of the turnover, dermatitis, as well as can affect the neurons and lead to dementia. And again, the biggest problem in this country, because we have all these vitamin stores, is hypervitaminosis, and they can lead to toxicity. So while you're studying for the USMLE, if you have a balanced diet, you will not get either hypo or hypervitaminosis.